Good evening, everyone. This week we've been tasked with discussing the term excellence as it relates to nursing. Much like the term power from a few discussions ago, excellence seems a purposefully nebulous word that mostly serves as a placeholder for some ethereal idea of effectiveness that a speaker may hope to conjure in their audience. So let's try and nail down a slightly more concrete idea of this term. Stanford Medicine takes a somewhat circuitous, however highly effective, path to defining excellence. On their Nursing Excellence homepage, Stanford Medicine lays out the actions that make the excellent nurse, as it were. They make the claim that their nurses, quote, skillfully care for patients, contribute to excellent patient outcomes, and continually advance the professional practice of nursing. While using the word itself in the definition of that word is certainly taboo, I feel that in this context the usage is somewhat acceptable. Even this though is still pretty vague, and only really serves to direct the reader to what what excellence in nursing may look like on the floor, not what it does look like. So to kind of move towards that, I want to hit a report that I found. So in a 2020 report that focused on the impact of leadership, or on the impact that leadership had during the early stages of the COVID-19 pandemic on both perceived patient care and perceived patient outcomes from the nursing staff, Aquila et al. Highlight the importance of perceived excellence. They also go in depth into explaining the components of excellence and how those affect patient outcomes themselves. Specific areas that promote the idea of nursing excellence include dependability, or one's propensity to do what one says, intercommunication skills, intelligence and wisdom, and familial support skills. A nurse that can effectively and deftly wield all of these tools is a nurse that can build an excellent experience and contribute to an optimal outcome for most patients. It's important to identify, though, at this stage that a nurse that can be considered excellent is not necessarily a nurse that makes no mistakes. Experience and failure are some of the foundations of knowledge and provide excellent opportunities from which one might grow both personally and professionally. One of my favorite sort of non-contributable phrases is that it isn't how many times one may fall that matters, only how many times that person chooses to get up again. This could likely be considered the true definition of excellence in nursing. No matter how many times you just don't feel like you made a difference, however many times you think that you could have done more or changed your approach maybe a little bit, what matters is that you take that knowledge with you into the next day and you try and do better. That is the definition of a truly excellent nurse and a truly excellent person. So I think that probably covers, or I hope that covers everything for this assignment. A little bit late on this one. So everybody have a good rest of your weekend, and see you in week 7, I suppose.